Good afternoon, everybody. I hope everybody had a good weekend. Nice Thanksgiving with your small group, your family, or your close group. I did. Just five of us at our dinner, which is unusual, but it was very nice. So thanks for being with us again today, and we're going to talk about COVID today. If you're watching the news, listening to any newscast, you know that we are in the middle of a big surge across the entire country. And, what we are concerned about now is that what some people have called the surge within a surge that could be caused by the get-togethers and the traveling and the fun that people had over the Thanksgiving weekend. So we're also concerned about that. For any of you who feel like maybe you were out and about more than you should have been over the weekend, self-quarantine after, 5 days or so, get a test, self-quarantine until you get the results of that test back. Because it's just really important. Our hospitals are they're at capacity, almost at capacity for their staff beds, and it's not just that they're not just taking care of COVID patients. Of course, they have lots of other patients too. So you want to be sure that there are beds for people who may have a heart attack, break their leg, have appendicitis. Our hospitals are still operating on all the other necessary treatments as well. So that being said, let me give you a little bit about the numbers here. In the city of St. Louis, our 7-day rolling average is 160 cases per day. Yesterday was 169. The day before was 130, 198, 235. So we average those. So our 7-day rolling average is up to 160. That's on the very high end. It has been as high as 166, but 160 is way too high. And we're worried, as I mentioned just a minute ago, about, excuse me, let me turn that off. Worried just a minute ago about the any surge that may happen from Thanksgiving weekend activities. People in the hospital in the region, and this number is 2 days old, so this is from Saturday. There were almost 1,000 people in the hospital, 994 to be exact, and those are in the 4 hospital systems that are here within our region. Of that, 202 were confirmed COVID cases that were in ICU. That's as high as it's ever been, and 127 people on ventilators. Fortunately, we also had 103 patients discharged 2 days ago and 108. So, but our numbers of people in the hospital are still going up. Now, looking at this compared to other places in the region, the city's numbers are still better per 100,000, but they're all way too high. So this is not a time to congratulate ourselves because they're all way too high and there's way too many folks that are sick. The other thing that we may see, of course, is as we go forward in this week, I'm anxious to see whether or not those numbers will, what direction those numbers are headed in. I do know that a lot of people had really small Thanksgivings. I hear from them, my neighbors, relatives, a lot of folks had really small gatherings and were wearing masks and doing their best to take all the precautions necessary. So I think we're all hopeful that these numbers will head down They're look like they're at a little bit of a plateau right now, but we've got to see a longer track on this before we know exactly what's going on here. So those are our COVID numbers. Too high. We just have to continue to say to people, please, stay put when you can. We know lots of people have to go to work, got to go to the grocery store, but keep your groups really small and stay home when you can. And we think that will be an improvement for us. So, couple of other things, stats. And for those of you that are interested in these numbers, you might take a look at the city's new COVID website. It's the same website, but there's just information presented in a slightly different way. I think a better way to help us all understand what's going on. We're running a positivity rate on testing right now of around 15% in the city. We are continuing to do extensive testing. Testing, of course, let's look here. Going back, testing is always, less on the weekend. But, last Monday, there were almost 1,500 tests just in the city alone. On last Tuesday, there were about 1,300. Wednesday, a little bit less, 930. And then we don't really have the results back from most of the tests that were, say, over this past weekend. We expect those results to be coming in here shortly. Let's see. I think that's enough on the numbers. The message is still the same. Numbers are too high. All right, on to a second subject here. Yesterday, our cold weather outreach started for our homeless population, folks that are on the street. Just by way of background, December, January, and February, we have cold weather outreach every night, regardless of the temperature. But when the temperature dropped down a couple of nights ago below 32 degrees, we started that process early. We do have a warming bus for folks that's at the corner of 13th and Chestnut. It's right across the street here from City Hall. And we do have over 700 homeless beds that are available in the region. Now, people are in most of them, but that's the capacity. We also are working to get additional capacity brought online here in the next few weeks, so you will see that as well. We have, since the beginning of this pandemic, the city of St. Louis, of course, as you know, the regular shelters had to reduce their population by half, sometimes more than half, in order to be able to space folks out and to not have the spread of COVID. So the city, through partnerships with various folks, added 385 beds over the last few months. That is, well, it's almost never enough, if I could say that. But because when folks think that there are services available, then they're going to go where they believe those services are available. But we are committed and have been committed to providing for folks who need it the most, our most vulnerable populations, and to doing it in the safest way possible for their health and for the health of the employees and the volunteers, which staff many of these facilities. So that has started. It'll run through the end of February, and it'll run in March too if we continue to have cold weather. So that's that. What else do we have on the list, Jacob?
We've had a couple of questions today, Mayor.
Good.
So on the post-Thanksgiving concern about COVID, when is the city anticipating, if there is going to be that surge and a surge, when do you think it will hit? And what concerns you about it hitting so late in the year as hospitals are already facing capacity issues?
Well, the surge is likely to hit within about a week to 10 days of Thanksgiving weekend. So is that Thursday, Friday, Saturday? So we're looking at the end of this week, early next week. And then, of course, we're headed into the holidays again, the Christmas holiday. And we're going to be asking people again to keep their groups small. So it will begin hitting towards the end of this week if we see that surge within a surge. So.
Question about hospital capacity. Many of them are very full, near 90% or fuller. What are the contingency plans on the back end of that if they were to be 100% full here in the city of St. Louis?
Well, we think about hospital beds not within the city of St. Louis. We think about them regionally because there are folks that can be transferred around within the region. What's already begun happening is normally we have very acute care available usually within this region. And so we do take in a lot of patients from outside the area. And that has been true with COVID also because we have the care, the serious care that's available for these acute patients. So sometimes those hospitals cannot take transfers. The other thing that, of course, is occurring is some the state is looking at some backup from the National Guard, if that becomes necessary, and doctors and nurses, healthcare providers, will have to begin making decisions about who they can treat the most successfully and who they can't. And you know, this is not so much a space problem. It's a labor problem. It's not enough doctors, not enough nurses in order to take care for people. So it's not about having the bed. It's about having the staffing to take care of you. And so those hospitals are beginning to have to make those choices about who they can serve most successfully and who they can't.
Cheryl is watching. Mayor has a question.
Hi, Cheryl.
Will we need a field hospital?
We don't think so, Cheryl, because as I said a minute ago, it's not about the space. It's about having enough doctors and nurses. And so if we built a field hospital, people have talked about, well, why not set up a hospital at the convention center? Why not set up a hospital somewhere else? Well, you have to have people to staff that hospital, and that's where the shortage is right now.
Speaking of other towns and other areas, a few folks wrote in asking if you could thank or commend places like Jefferson County and places like Washington, Missouri that have issued mask mandates and other restrictions when they previously had resisted those efforts.
You know, thank you for that comment. Absolutely. You know, the city of St. Louis and St. Louis County, we've had a mask mandate in place since early July. And our numbers have reflected better because we've had that mask mandate. Last week before last, I think it was Franklin County implemented a mask mandate, and just last week, Jefferson County implemented a mask mandate. And we know it's very helpful. It's proven that the higher compliance you have with the mask mandate. So it's not about the mandate. It's about getting the folks to wear the mask and follow the mandate. But having a mandate helps. I think it says to some people, oh, well, maybe this is serious. If you look at the numbers from the places that have not had mask mandates previously, their numbers have been considerably higher. If you look at last Sunday, city of St. Louis had half the rate, as actually even less than half in some cases, than the counties that did not have a mask mandate. So we think it's very important. And you know, I know it's hard to do it, especially when you have a lot of constituents who really do not want a mask mandate. But I think it was a really courageous and thing for those counties, Jefferson and Franklin County, to do that. And I would just say I sincerely appreciate that. And so, the challenge is, of course, getting people to follow the mandate.
We had a follow-up question from Nancy, who's watching.
Hi,
and
Nancy.
asked if you could explain what you mean when you talk about doctors who will have to make a choice between who they can and cannot best serve.
Well, if you listen to Dr. Garza's updates, and this has been all over the news, but if there's one doctor and two patients that need service, need health care, then that doctor has to make a choice about who will get his time and his care first. His or her, I would say, care first. That's what I mean by saying that you're putting really healthcare workers in very untenable situations. Some people say it's similar to wartime choices that have to be made. So
in the news this morning, the Moderna vaccine, they're seeking emergency authorization, the one that was trialed here in St. Louis.
Right.
Question about whether the city is working with the state of Missouri to make sure that vaccines get to our frontline medical workers first.
Absolutely. We've been speaking with the state of Missouri for, virtually weekly for, this entire time. And of course, the distribution of the vaccine, I think everyone agrees that it will first be distributed to healthcare workers. They are on the front lines. And so then after that, maybe nursing homes, maybe first responders. It's going to take a while before everybody has access to a vaccine. When I say a while, I mean months, not years. But so we have to get started, and if the Moderna vaccine gets the emergency order from the FDA, that will be good news for everybody around the country.
Question about the gatherings of 10 or fewer. Do you know if the health department had any issues over the Thanksgiving holiday with having to enforce that, or do you think the city of St. Louis did a pretty good job at it?
The gatherings of 10 or fewer, those were private gatherings of 10 or fewer. So honestly, we probably don't know how many people were at your house. But what the message that we were trying to send, and we continue to send, is that it really is not safe for you to gather in big groups. The safest thing for you to do is only to gather with those people that are within your household. And so I wouldn't say that the health department per se had issues with that, but we know that there are people who had more than 10, of course. We don't know who they are. But we're just continuing to ask you not to do that.
Interesting question from Ed, who is asking, when COVID is over, do you think it's possible that the city could consider some sort of memorial with the names of those who have been lost to COVID-19?
Ed, that's an interesting idea. I like the preface, when COVID is over. It's something we ought to think about.
On other issues related to homeless outreach, Mayor David is watching and asked if you could provide an update on the status of Tiny House Village and how people will be able to go about getting placed or considered for placement.
So David, the lease for the land, rental agreement for the land, I just got an update on that this morning. We expect that lease to be signed in the next couple of days by the comptroller, all the parties. And then the tiny houses, 25 of them anyway, 25 of the 50, they're ready. They can be delivered very shortly after we get access to the site. So I'm thinking within the next week or two for sure. And the continuum of care through and our human services department always maintain a list of people who need housing, and it's based on need first, and they have a screening tool which will help to place people in those tiny houses.
And probably last question for the day comes from Diana, has to do with downtown. Some of the changes that were made to address cruising and violent crime still in effect. Do you anticipate that that is the long-term solution? And will they be in effect through the duration of the winter season?
Diane, I expect they will be in place through the duration of the winter season. Now, we've made some tweaks to them. And when you say, is it a long-term solution? No, it's not long-term, but it is certainly a mid-term solution. And if there's something that you see that you think should be tweaked or changed, feel free to let us know, and we will take a look at it. The goal here is to make the roads safer, make the environment safer. And of course, long-term, we hope that we're on the other side of COVID and we have baseball at the ballpark and people going back to work in their offices downtown and folks going out to lunch and that sort of thing, which will help tremendously.
Actually, this is the last question. We just got it from Robbie, back on COVID. Wondering how and if the city, this has to do with trust in the vaccine, how and if the city will encourage folks to take the vaccine once it becomes widely available.
So that is a really interesting question, Robbie. Of course, I think we'll start with healthcare workers. And so I believe that once the communication is widely available and the vaccine is widely available and many people begin getting it without having problems, then I think more and more people will want to get it. Because as we know, getting COVID is a real roll of the dice. There are people who get it who have light symptoms, but there are many, many people who get it who have very serious symptoms, those 1,000 people that are in the hospital today. So rolling out the vaccine is a nationwide effort, as well as from nationwide to state to the local level. And we'll all be working together on that. We'll work through our federally qualified health centers, same folks that have been doing the COVID testing, and through doctors, people that you have confidence in. So
that's it for today. It is 2:30.
It's 2:30. Thank you all for being with us today. We'll be back to talk to you on Wednesday. And keep your group small. Wear your mask. Thanks all. Bye-bye.